The Citizens Commission on Human Rights, or CCHR, claims to be a watchdog group protecting human rights in psychiatry, but here's what they don't want you to know. CCHR is not independent. They're a Scientology front group, and their anti-mental health propaganda is costing lives. Sounds terrifying, right? But let's unpack it. I found this post on Twitter earlier on today. This is one of many examples of their propaganda. Yes, the number is real. According to the Australian Institute of Health and Welfare, AIHW, there were 9,964 seclusion events across public psychiatric units in the years 2022 to 2023. But here's what CCHR doesn't mention. The number has declined over time. In 2011, the rate was more than 13 per 1,000 bed days. In 2023, it's 6.0 per 1,000. Australia has national strategies to reduce and eliminate seclusion entirely, backed by reform, transparency, and patient safety programs. CCHR never says that some patients are secluded multiple times, so the number of people affected is actually less than 10,000. Then they claim the UN and WHO, so the World Health Organization, have banned seclusion. This is also misleading. The UN Special Rapporteur on Torture has called for an absolute ban, and the WHO strongly discourages seclusion and promotes non-coercive alternatives, but neither has the legal authority to ban it in countries. They are advocating, not legislating. So why is CCHR twisting the truth? Because their real goal isn't to protect vulnerable people, it's to eliminate psychiatry altogether and promote Scientology's mental health alternative. But here's the devastating truth. Their so-called alternative doesn't work. Take a look at this list of names. These are people they have failed. These are people that have taken their own lives due to psychosis, mental health issues that weren't addressed by Scientology. CCHR says psychiatry kills. But what about the Scientologists who have died from untreated psychosis, suicide, or medical neglect, all while underneath Scientology's care? Whitney Mills, denied help, told she was PTS, died by suicide. A Brisbane man, Edward McBride, harassed by Scientology in the days leading up to his death. When police asked for his files during the investigation, they sent them overseas to the US. Jenny Burpee, Lisa McPherson, Ellie Perkins, Philip Gale, Hervé Heaver, the list goes on. They call it clearing the planet. But are they really just clearing people? Permanently? Because while they protest psychiatry in the streets, inside Scientology, people are forbidden from seeking professional help. And when they break down, they're told it's a case error, or worse, a spiritual crime. So what's CCHR's alternative? Auditing? Vitamin megadoses? Denial of psychiatric care? These so-called solutions are costing lives, while things like silent births distract from the real dangers inside Scientology. And while they preach human rights, they're protecting an organisation with a history of forced disconnections, cover-ups, and even medical-related deaths. Human trafficking, child abuse cover-up. Let's be honest, you can't claim to protect vulnerable people and promote human rights while pushing propaganda that leads to suicide and neglect. You can't claim to protest against seclusion when you use practices such as the introspection rundown. You can't talk about human rights while denying people their right to mental health care. And you can't pretend to be independent when your founding documents, funding and headquarters are all Scientology owned. The abuse has to stop. Please share to help me continue exposing these front groups, the damage that they've done in the past and the damage that they are clearly continuing to do.